Hi guys, so one of the common questions I've been asked is, Shola, what do you do for work? What does your day-to-day role entails? In this video, I'll be talking to you about my day-to-day role and I'll be telling you what the role entails. Hi guys, my name is Shola and I'm a registered mental health nurse working in the UK National Health Service. On this channel, we aim to bridge the gap between nursing and finance. In the area of nursing, I'll be talking to you about revalidation, placements, and many more. In the area of finance, I'll be talking to you about payroll, payslip, tax relief, and so on and so forth. So, my day-to-day role involves working as a continuing healthcare nurse assessor. That's a CHC Nurse assessor. And I work with the CCG. The role of the CCG is to plan and buy care for the local community. Plan, organize, and buy care for the local community. So, what does my day-to-day role entails? My day-to-day role involves completing continuing healthcare assessment using the National Framework for Continuing Healthcare. The National Framework for Continuing Healthcare was revised in November 2018. Okay, and what were some of the key revisions in the framework? You know, they rearranged the domain. They implemented the Care Act 2014. They also clarified the purpose of the 3-month and the 12-month review that we do. Okay, in CHC we have tools that we use, and one of the tools that we use is the fast track tool. And this is a tool for individuals who are rapidly deteriorating, entering into terminal phase. So your end-of-life patient on anticipatory medication with very poor prognosis. Another tool that we use is what we call the checklist tool. This is a screening tool, and it's used to identify who goes on to the next stage of the CHC process. And that next stage is where you complete a multidisciplinary team assessment using a decision support tool. With a checklist tool, what you're trying to do is you're trying to establish if they have a positive checklist or a negative checklist. And how do we establish if an individual has a positive checklist? We look at the amount of A's they've scored on the checklist and the amount of B's they've scored on the checklist. A CHC assessment is really an assessment of needs. It's not a diagnosis-led assessment, it's a needs-led assessment. And what we're looking at is the individual's day-to-day care needs. And for those who have a positive checklist, then they screen in for a full assessment. And what we do is we go ahead and we complete a decision support tool. And this DST has 12 areas or 12 domains that we look at. So we look at the individual's breathing, we gather the evidence in their breathing, and at the end of that, we establish the level of needs in each individual domains. For patients who have got physical illness, they might be scoring highly in breathing, skin, and so on and so forth. For those who are LD patient, learning disability patient, and mental health patient, we might find that they might score highly in cognition and behavior. However, what we need to realize is that the individuals with comorbidities, some with physical illness and mental illness as well. So again, in this situation, we might find this individual scoring highly in 2 areas, actually, the physical health area and the mental health areas. At the end of this assessment, what we do is we make recommendations of eligibility. And when we make recommendation of eligibility, what we do is we look at the 4 key characteristics of needs. We look at the nature of the individual's needs, the intensity in the individual's needs, the complexity and the unpredictability of their day-to-day care needs. So these are called the 4 key indicators or the 4 key characteristics, and the individual just needs to meet one of those criteria. Okay? Remember that I'm looking at the needs and not their diagnosis. Okay? So once we make the recommendation, our assessment goes to a panel, the CCG panel, who makes the final decision. Again, if the social worker is not in agreement with the recommendation, what they can do is to dispute that recommendation. If the family are not agree with the final decision that is made, they can appeal those decisions, or they can appeal that decision. So in a nutshell, this is what I do for day-to-day work, and this is a short video about what CHC actually is. Again, if this is the first time you've seen my face, please don't forget to like, to share, and subscribe to this channel.